Good afternoon, everybody. We are so excited to have some of you all back. And if we have any new folks, just so you know where you are and what we're doing. This is part 2 of our 2-part series looking at trauma-informed and social justice-oriented advocacy strategies for college campus populations and emerging adults. I'm going to just we're going to do very quick introductions before we get back into it. I'm Leila Wood from the University of Texas Medical Branch Center for Violence Prevention. And I'll hand it over to Rick to introduce himself real quickly.
Hi, everyone. I'm Rick Gripprich, and I'm the Special Projects Administrator for TAASA, and also am the Campus Sexual Assault Specialist as well. So I do a lot of Title IX work around the state and working with colleges and universities to ensure that their response and that their policies and procedures are in line with survivors' needs and that survivors have access to services. And I live and work in San Antonio.
And I'm Dixie Hairston. My pronouns are she, her, hers. And I work with Leila at the Center for Violence Prevention. I'm the Senior Research Associate there, one of them.
I am honored and blessed that I get to work with Dixie. So that's my joy of the day. We are going to kick off a little bit where we started. And in the first session, we really did an overview of looking at advocacy services from a trauma-informed, social justice-oriented lens. Just to recap, if you're still, recovering from a wonderful lunch, we talked about how trauma exposure, in particular, adverse childhood experiences, IPV and sexual assault in adolescence, how all of that is part of what students bring with them when they come to a college campus. And we're really focused today on talking specifically about emerging adults, which are those people age 18 to 25. Now, many of you are working with less traditional college populations or graduate populations, so you're probably seeing people across the spectrum. Many of you are also working with adolescents. We really think a lot of this applies across the lifespan. So when appropriate, we'll add some different information, but really we're focused on those emerging adults. We also talked about the importance of having trauma-sensitive schools and having trauma-informed systems. And part of what we addressed is this idea that when institutions or systems are not trauma-informed, that we run the risk of survivors experiencing what some theorists call institutional betrayal, which is this feeling of being betrayed by their institution. And that can either be a psychological impact or a pragmatic impact, but institutional betrayal is one of the risks that we run when we do not have trauma-informed, social justice-oriented services. We also started to talk a little bit about the Campus Advocacy Toolkit, and we're going to put that link in the chat today. We're going to dig deeper into the toolkit, but Dixie started us off by talking about, the toolkit is a digital document that is on the UTMB website, and it is available for anybody to use. It talks about not only the design and implementation of campus advocacy services, but it also talks about different strategies for implementing those services and different considerations for working with this population. So when we're talking about campus-based advocacy, we're talking about a model that's adapted from the community, that's survivor-centered, that's trauma-informed, and that's social justice-oriented, and takes into mind all of the things that students and faculty and staff bring with them to the college campus. So we're going to talk a little bit more today about the toolkit and some of the things, kind of the critical adaptation points. So one of the things I get asked all the time, and I think Rick and Dixie probably get asked this all the time, is how is campus advocacy any different from community advocacy? And the truth is, it is not that different. These are all the same skills you probably already have. The context is different, the policy is different, and some of the needs are different. So what we want to do is dig into that toolkit and dig into what we have developed from the toolkit, which is a logic model with kind of essential skills and activities, and talk about those adaptation points. So to start us off, I want you to keep in mind that when we're talking about campus-based advocacy, we're talking about a model that's very similar to community advocacy, what you're doing in your RCCs and your dual programs, but that has 3 critical adaptations. The first is adaptations that are based on the developmental time span that folks are being served in, so that emerging adulthood period. The second adaptation is taking into account the university community experience. So basically that folks are living in these small, or if you're at UT Austin, so I live and work in Austin, and I have a map of Austin behind me. The UT campus is 50,000 plus students. So that might be larger than some of the towns you all live in. And then also that for campus-based advocacy, there is a specific policy context that guides those advocacy services, along with all the other policies that guide advocacy services that are important to keep in mind. So that's what we want to do today, is kick it off by talking a little bit about that policy context. If we could go to the next slide. So we had talked previously about how campus-based advocacy is adapted from community advocacy in its focus on psychoeducation, its focus on the greater university campus, and part of that is, creating a trauma-informed campus. But one of the other critical adaptation points is the role of the institution in institutional level policy. And no place else do we see this quite as strongly as accounting for policies that affect not only college campuses, but also high schools to kindergartens, which is Title IX. So if we go to the next slide, please. Title IX it is one of the factors that governs a lot of what we do in campus-based advocacy. Along with Title IX, we also have some state policies that govern how we can provide services and what some of the limitations of our service provision are. So I want to start by focusing on the federal policy. And the first, of course, is Title IX. The second is Title VII, and Title VII is Equal Opportunity Commission type of title. It's really referring to employment situations. So when we're talking about faculty and staff, Title VII becomes really important. There's the Violence Against Women Act, or VAWA, and the Campus Save provision of that, which gives a lot of detail around protections around confidentiality, remedies for survivors. And then we have FERPA, which is guides a lot of how we deal with student protections and what we can say about students and what we can't say about students. We also have the Clery Act, which the Clery Act really is about, it's named after Jean Clery, who was murdered on her campus. And it's really an accountability tool to help colleges and universities be more transparent about crimes that are happening on their campus. Now, practically what happens is all of these policies get gnarled up in these tight little interlacing knots, and all of them affect our practice. Now, in Texas, we have 2 specific state policies that Rick is going to talk about that also affect advocacy practice. So Rick, I'm going to pass it over to you for the state stuff.
Sure, and feel free to chime in as well, since, or anyone really who works on a college campus, and let us know how these have affected the way that you do your work. But so in 2019, one of the first ones that was passed in regards to campus sexual assault was Senate Bill 212. And this is basically a mandatory report bill, right? And so it required that anyone who works on a college campus is considered a mandatory reporter. Now, there are exemptions for it. So folks who carry confidentiality, counseling departments, victim advocates, if a school has designated other students to be victim advocates, then those folks can keep confidentiality as well. But for the most part, if you are a faculty or staff member and you know that a sexual assault has occurred or have information that one occurred, it is your obligation to report it to the authorities, right? Mostly to Title IX. This is a very interesting bill, and I'm going to speak about it from an advocate perspective, because in the very first iterations of this, it included a stipulation in there that kind of sort of made students mandatory reporters as well. And so that was not really going to fly because it was just weird. It didn't really give a lot of survivors options for who they could talk to about what happened to them. And so this final iteration of it is basically just for faculty and staff or anyone who works on a college campus or is employed full time. The weird thing about this bill, as in theory, as good as it is, right? Because it's akin to, when a child abuse mandatory report laws, it's kind of akin to that. But the weird thing about this one is that it criminalizes faculty and staff if they know about a sexual assault and do not report it. So basically, if, and Leila, correct me if I'm wrong, but basically if a faculty or staff member knows that a sexual assault occurred or a student reports to them, to a faculty or staff member that they were sexually assaulted and they do not report to authorities or to Title IX, and the university finds out that that faculty or staff person knew, then there are some punitive measures. That faculty or staff person can be fired or should be terminated. And they also could face some jail time. It's also a misdemeanor charge as well that could potentially be filed against them. So there's a lot of unintended consequences with this one. The main goal, of course, is to increase reporting, but I think in talking in terms of unintended consequences, I think for a lot of survivors, this might inadvertently push them a little further back into not reporting out of fear, because they don't want to get someone in trouble, or they just aren't ready to tell, or they don't know who to tell, and they don't want their favorite professor to go to jail or to keep their confidentiality when they're asking them to. So it's a kind of a bit of a conundrum, but overall the intent was there, to increase report. But I don't know if we're too far into this yet to determine data or numbers if whether or not this has inhibited reporting. But just from an advocate perspective, it feels like it does. And then HB 1735 is another kind of interesting way to put it. Is it's almost like Texas's own version of Title IX. And it almost kind of mirrors what the Obama regulations were, and requires colleges and universities, secondary schools, higher education institutions to adopt policies and procedures and training and trauma-informed investigations, all of those things that were part of the first iteration during the Obama administration. So that one, in essence, is really good. What it also does is it authorizes schools to designate either one or more students that are enrolled to become victim advocates, that other students who are either sexually assaulted or experience dating violence or stalking or any kind of harassment, that they can come to them and speak confidentially to. So this is a good thing. The interesting thing about this one, though, is it mandates things like trauma-informed investigations for police officers, but it only authorizes institutions to designate. It doesn't mandate. So a university can say, well, we're not going to pass that burden on to students, and we'll only keep it here. It would have been great if it would have said you must designate, or at least create a program for students to come and either volunteer or gain credit hours for, things like that, so that they can become advocates, because that really is kind of rooted in this foundation of institutionalizing advocacy at a campus. So there's those two. Leila or Dixie, do you guys want to add anything to that, or did I misspeak at all?
No, I think interesting is probably the best way to phrase it. And, you know, I would say there's a great discussion in the chat right now about, you know, this issue related to federal funding and private institutions. And I'll just say that while I'm not a lawyer, you know, what we understand is that federal and state law has to be followed regardless if you're a private school or not. But the main stick that the feds can offer is taking away federal funding for universities that are not compliant with Title IX. Now, for our state bill, like SB 212, it's a little bit more nuanced because there's some individual level repercussions. I think it's a misdemeanor if you don't share the report. I will say that, you know, we did a survey of advocates at the end of last summer, beginning of last year. And what we heard kind of overwhelmingly from that is that the SB 212 has made their work a lot harder because there's not as many options for reporting, and the mandated reporting structure is so intense that it makes it really difficult for survivors to come forward. And mostly what we're hearing from both survivors and from advocates is that it just makes everything confusing.
Right.
That between the Title IX changes and between SB 212, there is every school is kind of doing it differently. Some places have more confidential advocacy, some don't. So there's just, it's a little bit difficult for survivors to navigate what their options are.
Yeah, and you know, we've all kind of had this question as well because, you know, when the Trump administration came in and Betsy DeVos's education department totally changed Title IX, it conflicts with what Texas passed. And so which do you follow, federal or state? Well, you follow both. And then, but which one, but ours mirrors the Obama administration more closely. And then we've got these new ones at the federal level. So it's very confusing. And to throw another wrench into it, it's all probably going to change again. With the Biden administration. So you may see it going back to what it was before, which, you know, in essence will mirror what we did in the States. So yeah. And FYI, someone wrote in there like the original iteration of this bill sounds really isolating for survivors. Absolutely, specifically with that student component being mandatory reporters. And that is something that, you know, we did not we did not initiate this or lobby or push for this or initiate the start of the conversation of this. This came from a different senator's office this was the second time trying to pass it. But when we understood what was happening, we did advocate for that piece to be taken out. So your lovely TAASA membership dollars were put to great use because that's exactly what we did.
So if we go to the next slide, because we anticipate now with the change in administration that it will change again, I just want to share some resources that I use to keep up with Title IX. If you're in the UT system, some of the best resources, if you're in the University of Texas system and, you know, one of the 14 campuses, then we have a system-wide Title IX coordinator, and her name's Krista Anderson, and she offers a lot of trainings and has a lot of information archived. But she shares with other colleges and universities, so she's a great resource. We have some other resources here that we typically share that are really helpful. And if we go to the next slide, specifically Know Your Title IX is very accessible to survivors and advocates. So this is, again, from those more recent Title IX regulations. Again, we expect and have heard that these will change again. So right now, this is, you know, what we're living with, which obviously some of this conflicts with the goals of campus-based advocacy as we've talked about it. One of the things that we've learned in the 3 years that we have been studying campus-based advocacy is that it is absolutely critical that a school have a confidential option. And that's just something I think as a team we feel strongly about, but the research, and the reason I feel strongly about it is because the research supports it so heartily. is that having a confidential option that's clearly marketed, especially on your internet sources. So when a survivor gets referred to services, either from the counseling agency or the local rape crisis center or the university health service or a friend, most likely, the first thing they're going to do is pick up their iPhone and Google it. And that is going to be, you know, the one of the first entrees into service. So as much as you can have on your webpage about how to report confidentially, what it means to report to Title IX in plain language that survivors can digest, the easier it is to make decisions about how to approach reporting mandates. So that's something that, you know, we would just say really strongly is having that confidential option is really critical to providing survivor-centered, trauma-informed, social justice-oriented advocacy services.
I 100% agree.
So, talking about advocacy and practice, we would like to go through the toolkit and start talking about the various skills that are adapted and that you probably already are using. And we're going to kind of be going back and forth with this a little bit, but I think Dixie's going to kick us off.
Yeah, so just the way that this part of the session will work, we'll go over the goal, and then in the next slide, we'll highlight a skill, an advocate skill that we think maps to this particular goal, and then we'll talk specifically about trauma-informed care items that go along with each goal. So goal number 1 of campus-based advocacy is secondary prevention of violence and harm. So basically this means when someone comes into our office, how can we make sure that they are safe and increase their of empowerment and safety and decrease the likelihood of them experiencing violence in the future. So one particular way that I think this maps to social justice issues is understanding the intersection of intimate partner violence or sexual assault and systematic oppression that occurs as well. So as advocates, understanding that individuals may be coming into our offices experiencing a range of different types of violence, and understanding that we need to take that into consideration when we're talking to them about safety, about their civil rights, about the interactions of different systems on campus as well as out in the community. So the skill that I'd like to highlight for goal number 1 is safety planning. So everyone is probably on this workshop is probably much more of an expert in safety planning than I am. So I will not go into the details of safety planning, but just to say that there needs to be lots of conversation. It's a dynamic process. It's a back and forth. It's working with individuals and different systems on campus to ensure that your individual client is safe, as well as the community across campus being safe. One element that we'll highlight later that we have found in our research is on campus-based advocacy in particular, talking about academics and how students can stay safe if they're in in-person classes, walking to classes, while they're in classes, or virtually, how can they be safe in the future? But we'll go more into depth in that later. So like I said, this is typically safety planning with the adaptation of understanding that the campus community is sometimes very small in that a lot of people know each other, especially if individuals are coming from Greek life or different organizations on campus. And importantly, when we are doing safety planning, it's very important to understand that the survivor knows how to keep themselves safe. Their knowledge, their reactions, their goals are the most important thing to keep in mind. And then I'll pass it over to Rick to talk more about how to incorporate trauma-informed practice into safety planning.
Thanks, Dixie. Another kind of aspect to look at is the environment and the campus in general, right? And how safe do survivors feel when they're accessing services? So some of the considerations that you might want to look at are, now again, if you're a campus, these are things that, if you're on the call and you're a campus, these are things that questions that you can answer yourself and see where you kind of fall on the spectrum of all of these answers or these questions. And then if you're an advocacy organization or a rape crisis center that may work with a college campus, when you're at the table or meeting or trying to figure out how you want to partner, these are some things that you guys can go through to assess where folks are, right? Or where that campus is. So consider like when and where are the services or the programs being delivered? Is it accessible during times when students can access it? Is it 9 to 5? Are there after hours options as well? And how are students able to access that? So what safety considerations are important in service and program delivery? What signs and visible material are available? What does the waiting or the reception and therapy advocacy rooms look like? Are they trauma informed? Are they scary, cold, dark, or sterile environments, or are they welcoming and comforting? Are survivors provided with clear information and explanations about each step and the procedure along the way? And most importantly, to piggyback off that one, does every contact that you have with a survivor, does it conclude with information about what the next step is? Are we being proactive in explaining and giving the entire process and what to expect after every time we see them, meet with them, talk to them on the phone, right? Or at least giving them an option to ask, or if they don't ask, see if they have any questions about what's going to happen next. What events have occurred that indicate a lack of safety, physically or emotionally, and considering that as well. What triggered these events, and what alternatives could be put in place to minimize the likelihood of them happening again. And are staff attentive to the signs of survivor discomfort or unease? Do they understand these signs in a trauma-informed way? And this kind of goes back to what we talked about in part one, is understanding trauma and understanding how it affects survivors. And the more knowledge you have, the easier it is for faculty and staff who are working with survivors to be more comfortable in making them feel comfort, making them feel at ease, and making them feel like, I feel safe and I can access these services here. Go to the next one, Dixie. So throughout these goals, you're going to see two different approaches. One is from a survivor or a student approach, and then another one is faculty and staff. So I'm not going to highlight these, but these are going to be in the materials just for the sake of time. But I want you to remember when we talked about it in part one, is that this is a holistic approach, right? This is not just relegated to only students who might have issues surrounding DVSA, domestic violence, sexual assault, or stalking. But staff members might also feel that too. Staff members also feel vicarious trauma, right? So the weight of all of that is going to be bearing on them as well. So we're gonna have information here about some considerations on how to be trauma informed for faculty and staff too. So you can kind of read through these really quickly, and then we'll move on to the next goal. Oh, sorry, discussion.
So if, since we have kind of a big group, if everyone will drop in the chat some discussion around either how your programs or recommendations for how you can specifically address the impacts of trauma and violence with individuals, for individuals with BIPOC identities. If you'll just drop that in the chat. So this is either discussion around how that can be achieved, or what you are doing, what you do as an advocate, what your program does, some ideas around that. So if Leila and Rick, if you want to talk about specific examples, one thing that I have heard in my interviews with students is making sure that your marketing materials, photos, even your language and your materials around your program present people with different identities, and it's not just individuals from one identity. So we're seeing let's see, Nicole says, diverse staff as part of Title IX team at levels investigator to decision makers, program in collaboration with the departments. Yeah, absolutely. So making sure that you have a diverse staff in many ways. Ruben says outreach, training, collaborations. Yeah, absolutely. Making sure that you are hearing from individuals in BIPOC communities, getting feedback from them, understanding how your programs or even your work as an advocate one-on-one can be expanded to address people with different identities. All right, so we will move on. Leila, I'll hand it over to you for goal number 2.
Okay, so goal 2 of campus-based advocacy, very similar to working in the community with some important modifications, is survivor agency and empowerment. And really what we're looking for in this specific goal is to offer a lot of choices for services, to engage in goal identification and planning, and then to keep progress of those goals. And then really a lot of this goal involves providing psychoeducation about the causes and impact of unhealthy relationship, interrelationship with systemic oppression and barriers. And so one thing that, going back to that initial adaptation point of the developmental span of emerging adulthood. So campus-based advocacy really has a ramped up focus on psychoeducation. So you may even have an advocate that's a counselor that's providing trauma counseling, but a lot of what they're doing is things like taking out a power and control wheel, sharing it with a client and saying, you know, here's a little bit of, that we know about relationships based on power and control. Do any of these seem familiar to you? Do they resonate with you? Using a lot of different psychoeducation tools to work with collegiate survivors. Part of the reason, unfortunately, that that's so critical is we don't do a great job doing psychoeducation earlier in the lifespan. Now, you may live in one of the areas of Texas where our prevention game is ramped up, and boy, we are trying. Boy, we are trying. But when you have a kind of a systemic lack of psychoeducation about healthy and unhealthy relationships, sexuality, consent, when you have a lack of appropriate sexuality education, you have students coming to college with a lot of questions about relationships and sex and sexuality. So that psychoeducation component becomes really important. And what we get from that psychoeducation is increased agency and empowerment through information, which reduces self-blame, which helps meet goals, and in the longer term really reduces the negative mental health consequences of victimization. So just a skill highlight on psychoeducation, not only is it psychoeducation about consent, about relationships, about what a pap smear is, it is psychoeducation about the impact of trauma. A lot of what advocates do is unpack trauma impacts and really make linkages between things like substance or an alcohol misuse and disordered eating and trauma reactions, or talking through, the way a panic attack may drain your body of nutrients and energy and what you need to recover from that. So there's a lot of information about not just, the healthy relationships, sexuality, and consent, but about what trauma is, the neurobiology of trauma, kind of, I'm forever going to think of Rick's Staying Alive slide. But, even advocates are explaining the limbic system to survivors. They're explaining neurobiology, and they're helping people understand what's happening in their bodies and in their brains. So we can go to the next slide. Over to you, Rick.
So to kind of piggyback off of what Leila was talking about as far as long-term outcomes, right, which is the ones that resonate with me most are increased reported power in own life, and then survivor-identified long-term goals are met, and then reducing negative consequences. And I think it's one of the things that Leila said was empowerment. And so when you're looking at how you're delivering your services, or you're looking at what is good for survivors, it's always a really great way to think of it from, again, these kinds of questions. In any kind of routine service provision, how are each survivor's strengths and skills recognized? What are you doing to promote that? How much choice does a survivor have over what services or programming they receive? And I think that's part of a larger conversation. I'm going to probably say this 80 million times, but it would be amazing and wonderful if every campus in the state of Texas could institutionalize advocacy and make it a part of everyday things. There are some folks who have already done it. UT Rio Grande Valley is a really great example of what it means to institutionalize advocacy, and so is UTSA. UTSA has done, which is UT San Antonio, they've done a really great job of institutionalizing it as well, and that requires a commitment from their president to do so. But it really, and what they've done, just to give examples, is give them the choice over what kinds of services and programming they receive. So when making decisions about it, survivors are at the table, or students are at the table, or peers are at the table. Does the program or the organization or the department communicate a sense of realistic optimism about the capacity of survivors to reach their goals? And does the program, organization, or development foster the involvement of survivors in key roles wherever possible? And for each contact, how can the survivor feel validated and affirmed? And I think by understanding, again, going back to what we talked about, understanding and acknowledging their trauma, that is one of the best ways to validate and affirm a survivor. Go ahead. So what are some of the ways that advocates might talk about systemic oppression with clients related to the impact it has on mental and physical health? This is another discussion question that you guys can drop into the chat box and give us some feedback on that.
Yeah, I would just even love to hear, like, are people talking about the impact of discrimination and microaggressions and immigration policy, and is that something that's coming up in their individual work with survivors?
Leila, when you're talking to different programs, when doing research and doing interviews specifically with advocates, do you find that this is something that is a difficult thing to do? Or is this something that a lot of centers have incorporated into their everyday practice? Or, I'm giving you a lot of loaded questions, or is it done on an individual basis?
It is done on an individual basis, and it's particularly hard for white advocates to do. And that's where I would say we need some training and support. And it's a lot of times it's a skill set that they're hoping to develop. And I would say some of the campuses where immigration is a front and center issue because of the context of where they're located have a much better handle on something like, how are these changes in policies and the conditions on the border impacting our dreamer students, than places where that's not an everyday occurrence that they're facing. Places with big international student contingencies. So I would say it's something that is, a lot of advocates are just doing it naturally, and they're using their own identity positions to navigate spaces, but that it's an area where there needs to be a lot of growth. Is that match with your experience working with campuses?
Yeah. it's that whole micro piece, like it's being talked about there, but then getting it, getting everyone to understand it at a different level or from an entire system approach is very hard.
All right. Dixie, you want to move to the next one?
Yeah, and just to add to that discussion, I think that what you said, Leila, is really true in that this is particularly something that white advocates are thinking about, but also obviously have the most trouble integrating into their work. So I think it's something that really needs to be addressed. And like I said earlier, from the data, students and survivors appreciate when you're upfront about what your identity and what you do and do not know. So moving into goal 3, this is talking about kind of leading from that discussion question, the goal of reducing mental and physical health consequences of the violence and harm, as well as other forms of oppression that students have experienced. So what we're looking at, the activities for this goal, the skills that you need or use as an advocate are providing information about the impact of trauma on someone's mental or physical health. Like I said, about psychoeducation, so what is physically happening in your body when you are experiencing a symptom of trauma? What formal and informal support systems are available on campus for students to seek out when they are experiencing negative mental and physical health consequences of the violence that they have experienced. And importantly, always using active, non-judgmental listening skills when students are talking about some of the mental health and physical health consequences. So again, to reiterate what we have previously said in part 1, very often it's that first reaction that a student gets, or a survivor gets rather, when they first disclose, that really sets up how they are going to experience their recovery, what services they're going to access. So active non-judgmental listening is really important. So the last skill I want to highlight is looking at some grounding and coping approaches. So as we have not been very excellent in psychoeducation and prevention education before students get to college, there's also not a lot of, we don't get a lot of wellness strategies, right, in K through 12 very often. And I think that's improving, but thinking about this population of emerging adults, really just helping them understand healthy, and I say that with quotes, healthy coping strategies, coping approaches. So these are just some that we highlight sometimes, but you as advocates, counselors, we all have our different coping strategies that we like to teach. These are just 3 that could be really helpful for students or individuals on campus. This box breathing is really interesting. It's actually one of the individuals, survivors that I interviewed, talked about their advocate teaching them this type of breathing. And so that was really impactful for them. So I think it's just understanding, listening to the survivor, talking them through some coping strategies. And what we've heard from survivors is like, yeah, my advocate told me that and it didn't really work, but then about this other thing and it's awesome, I use it all the time. So it's really, there's not a one size fits all, just like there isn't for any of the other skills. But just having some of these readily available that you can pull from are really helpful as an advocate. So I'm going to switch over to Rick to talk about some trauma-informed practice.
So you're probably sick of me saying this, but acknowledge the trauma. That is one of the most important things. And we also need to, again, normalize and validate survivors' feelings and experiences. And if you notice here, this one says survivors and faculty and staff, because this can actually work across the board with everyone. It also requires us to consider assisting them in understanding the past and its emotional impact. And actually somebody put that in the chat earlier about working with survivors and dealing with quite a bit of past oppression or past marginalization, and what that does to how they look at systems and how they approach it. So super vital, super important to recognize those past oppressions and the impact that that's going to have on them. So we also want to empower them to better manage their current lives, help them understand current challenges, considering their past victimization, and also looking at whether or not counselors, mental health professionals are trained in trauma-informed CBT and DBT, cognitive behavioral therapy. And is that right? Is that cognitive? Did I get the C right?
CBT and then CPT and
cognitive processing.
And
right?
then there is the DBT, which is the dialectical behavioral. There's probably some counselors on this call that are going to bail me out here. I mean, I think
yeah, totally.
Big one is EMDR, right?
Yes.
Bail us out, counselors in the chat. What trauma therapies are you liking? Chat in and save Rick and I.
Well, and I know, and thank you for that, Leila, because therapy and counseling is not my forte, but working at a rape crisis center and understanding the different modalities that a lot of the centers use. And when I worked at the Rape Crisis Center, EMDR was hugely popular and still is, and it is extremely effective. And so is DBT, which is the dialectic behavioral therapy groups, right? Which is, if I'm not mistaken, okay, counselors and therapists, bail me out of this one, but this is where therapists work on acceptance and work on strategies that are like really geared at changing and recognizing and kind of synthesizing all of those things. Am I right? I'm going to say yes. Okay. And then are students screened for ACEs? And then most importantly as well, are you collaborating with local experts, right? So can you bring a therapist from a rape crisis center or someone who is specifically trained in these modalities that we know work with survivors, specifically of sexual violence? Are you bringing them to the table? Are your therapists in your counseling department getting a chance to have didactics with these other therapists? Are they needing to talk about cases, anonymously, of course, but to talk about how you can be better at what you're doing or to understand these types of victimizations? And I think that is super key. And it's also trauma informed, right? And that was one thing that working with some universities that I saw is that, you had one therapist who specialized in family violence or sexual violence, and all of the other therapists or counselors on staff didn't have that training. And so they didn't want to work specifically with survivors of sexual assault. And so they would all give them to this one therapist who was completely overwhelmed and overloaded because I don't understand that and that's not what I do, right? And so it's not fair, but increasing that type of understanding of this victimization is really, really, really key. So everyone who wants to know what I just completely flubbed, read the chat. Deborah so kindly gave us some of the modalities that she uses and other things. So thank you, Deborah. We appreciate it.
Okay, so we'd love to have a chat in about this. Yeah, I'm excited about this. So UT Austin has a model where they are merging advocacy and counseling in the same sessions in one of their advocacy shops. I'm just curious if anybody else is integrating those two together. Sorry, Dixie, I got excited.
So another discussion question, I know y'all have already kind of done this, but are you integrating counseling into your current advocacy services? And if so, what does that look like? I'm going to say that the hope is that 100% do. That counseling is just a part of the long-term care that we know is so vital and beneficial. So I'm going to ask a sidebar question really quickly. And if everyone could just say yes in here and tell me what this would look like. But this is something that we sometimes during our conference, we don't get a lot of therapists and counselors who are doing work specifically with survivors who are talking about their modalities or talking about the different types of strategies that can be very helpful. If that's something that you would like to see, I encourage you to put that into your evaluation or put it in here in the chat, and I'll make note of that as well. But I just wanted to throw that out there. Okay.
So it sounds like we've got some use of counseling, some of the community-based agencies having counselors on staff with a lot of integration of counseling with advocacy, maybe sometimes almost too much. But I'm not sure if it's you know, I think it's really helpful for folks. What we've heard from survivors is that the integration of counseling and advocacy is really wonderful for them, and often they didn't, you know, we've interviewed several survivors who we know because of how we recruited them, that they were engaged in this hybrid model, and they didn't think about it as a hybrid model. They just thought the advocate had a lot of intentionality around mental health services. So that's interesting that, you know, that's kind of the perception. Okay, so goal 4 is really this, you know, part of what we look at with advocacy on campus or in the community is we are increasing resources to survivors. And we are sharing not only are we increasing resource, but we're increasing information access. And how we really think about this is basic needs and material support. So not only are we referring survivors to community resources, we're referring them to campus resources and helping them navigate how they're going to use those support services. In some campuses, this may look like we're providing housing support. Like I can think of a couple college campuses that actually have dorm rooms that they use for survivors if they're not safe where they're staying. And what we find from that resource provision is really critical, because if you can think about a time in your life when you have been short on money, and maybe you are a blessed soul who has not had this experience, but I grew up poor, single parent household. I always knew when rent was due when I was little. And I have, you know, I'm really proud of my mom and happy to share that piece of information. But, you know, if you have had a time when you were broke, you were really broke, it's depressing to be poor. And it's a lot of work to be poor. You really have to hustle to get resources. So part of the goal of this, goal 4, is pumping resources into survivors in order to be able to get them their needs met, which then reduces mental health impacts. So part of that in the short term is just increased knowledge. A lot of these these emerging adults haven't used community-based services before, so they may not know who can use food pantry, who can use housing assistance. So there is a psychoeducation component. And then in the long term, what we're seeing is not only is there increased knowledge, but there's a better sense of well-being and an increased sense of community. And yes, so the campus I was referring to that occasionally has dorm rooms is UTRGV. So yes, that was the one I was thinking of when I said that. I don't know that they currently have them, but they have in the past. They're very forward thinking on that. And that resource acquisition part is, there's this idea that college students are highly resourced. And I understand that on some college campuses, they are highly resourced, but the Young people who are going to need resources the most are often our survivors. And they're often our low-income survivors, or our survivors who have other forms of oppression going on. They're cut off from their family because of their sexual orientation or gender identity. These are the survivors that need these resource provisions more. So if we go to the skills.
And I really quickly, I'm sorry, Leila, UTEP.
Okay, I'm passionate about this one too.
I think UTEP, I think someone is here from UTEP. Elisa, can you just drop in the chat? Do you guys have housing as well for advocates? I remember when we were there, the answer was yes. So can you just put that in the chat? That'd be really helpful. Yep, UTEP has it as well.
That was the other one I thought, I'm glad, yeah. So some of the, it's really interesting to me how colleges use their resources. And I say interesting in that, I look at RGV and UTEP as real models for how they're addressing housing. The other thing that I would strongly encourage you to do if you're an advocate on a college campus and you haven't done this yet is I would get with your community rape crisis center or your community dual program, DV program, and I would ask them if there's any way to partner on housing. Housing is this area that we don't talk a lot about in campus services because of this assumption that survivors don't need help with housing, but they absolutely do. It's one of the top needs. So just my little pitch there. So just thinking about resource acquisition, one of the things that we really want to emphasize is that part of the skills that advocates are working on is help-seeking assistance. By help-seeking assistance, we're talking about not only am I going to give Dixie a referral to a food pantry or to an external counselor, I'm going to work with her to tell her to answer any questions she has about that, to help look up eligibility criteria, to help scaffold for her how she'll call and reach out and get that service. Because I don't know, especially this generation, my 20-year-old niece is living with me right now, and getting her to make a phone call was an interesting experience. She wanted to text, she wanted to chat, but she did not want to pick up the phone. So really thinking about working with folks on what questions and hesitancies they have. Because what we found is that giving a referral really isn't enough. Helping people learn how to use those referrals and to answer their questions, their concerns, the stigma that they may have about using that. We have two examples here of kind of help-seeking assistance. And we look at that as kind of a formal help seeking. So if I'm reaching out to a formal entity, and then informal, which is helping people figure out how to reach out to friends and family. So help seeking assistance is really an important part of helping survivors get resources. Next slide.
And then very simply, I'm sure you guys recognize the pattern here, right? Here are some other things for consideration in how to be a little bit more trauma informed in actually practicing these. But consider, is there a resource center on campus where students, faculty, and staff can access information about services that the campus provides or about services in the community? Is it easily found? Is it on a website? Is it front page? Is it all of those things, right? Nothing is more frustrating, we all know this working with survivors, than having to dig for information. Does the counseling office or advocacy center offer any outside services or case management to deal not only with the sexual assault, but with all the other issues or concerns that may arise as a result of it, right? So we know that for a lot of survivors, again, thinking back to ACEs, thinking back to risk factors of growing up and how that led to where you are now as an adult. And then in our work with survivors, we know that sometimes a sexual assault is literally just the tip of the iceberg, or it's not the most pressing thing that has happened to them in their lives right now, right? Because I am dealing with depression already. I don't have a job. I am failing out of school already. I'm not succeeding in all of these other things. I don't have transportation. I can't get up in the morning because of my victimization. So there are all of these other factors that we know are compounding and making that trauma sometimes worse for survivors. So do we have Are we providing either access to outside services for case management, or is the university or the college or the campus going one step further and offering these holistic approaches? Again, not just dealing with the sexual assault, but all of those other things that come up with it. And then does the campus collaborate with community agencies outside of campus to ensure that holistic and comprehensive approach to support services? I'm going to emphasize that. I can't emphasize it enough. I'm very fortunate to live in San Antonio and have folks like UTSA and Our Lady of the Lake and Trinity who are really understanding in what their students need in terms of access, and in some way, shape, or form have instituted, whether it's institutionalized or whether they've gotten a grant in order to provide these services, have understood that their needs need to be met and we need to provide some level of advocacy. So I'm really fortunate to be a part of helping them do that. And I learned so much from how they work with survivors. And so again, are community-based agencies present on campus or part of conversations and meetings that speak to response and intervention? I can't say that enough, and I'm going to stress it ever more. I feel like our community programs need to be a part of these conversations. That is a really great way of, again, ensuring that if there is something that you can't do or you can't provide, or it's outside the scope of the services that you can provide on campus, you have this community partner, this ally, this person who understands it on a very different level or even on the same level, and can help assist, right? So it's an easy transition from you as a campus to a community-based organization if you have that partnership and that allyship as well. Okay. So with that said, what do your current outreach efforts look like to ensure that students know about or have access to services? You can drop those in the chat. And I expect my San Antonio peeps to show up and represent on this question, because you guys are doing some good work. Okay, keep thinking about it and we'll move on to the next goal.
All right, so goal 5 is moving from that question into striving to support, build, and repair formal and informal social support, both on and off campus. So really looking at both your relationship, the advocate's relationship with the individual, and also the individual's relationship with their informal social support network, which could be friends, family, clubs and organizations on campus, and then the formal support. So something that's coming to mind would be like a counseling group session or a drop-in or something like that, that is formal and in place and there to support survivors of violence. So what we're really hoping to do, long-term outcomes of connecting to social support, is decreasing that isolation that we were talking about earlier, really engaging students with positive social and peer support, increasing or repairing their sense of community, and the element of institutional betrayal and institutional trust really comes in to this goal as well. So it's both a micro one-on-one connection and social support, and also this macro idea of how can we rebuild the trust in the institution, the sense of community, and then individually using the coping skills that we've that we've worked with survivors on to help mitigate further impact of trauma. So the skill that I want to highlight for this goal is facilitating timely access to services. So really, we've talked about this a lot already, but as an advocate, there are many things that you want to do kind of all at once based on what the survivor is needing. So really, you are a conduit to a lot of other services on campus or in the community for survivors of violence. So someone in the chat said something really brilliant about this. It's that advocates help connect to resources so that counselors can focus on the impact and the feelings, the trauma symptoms that come up in relation to their violence, the violence that they experience, survivors experience. So obviously there are a lot of different services on campus and in the community that advocates connect students to, but some of the ones that we most commonly see in our evaluation is healthcare services, the Title IX office. So this is both information about reporting, and also like how the process will work, and then giving a handoff or a referral to the Title IX office, as well as the accommodations office, which looks a little bit different based on the campus that you're on and the context of what that office does, whether it's Office of Student Support or Office of Students with Disabilities, those types of things. So the one thing that I'd like to bring up before we move on to the trauma-informed practice, having a warm handoff to these things, to these different systems on campus, really can help mitigate some of the systemic oppression and or microaggressions that students experience when accessing these services. So if you as an advocate know, and I've heard this from when I'm interviewing advocates, is they know that this one particular person at the that deals with accommodations in the Office of Students with Disabilities is really good at working with survivors of violence, and they understand, they've been through training. So this one advocate said, I always do a warm handoff to this one particular person. And that really helps facilitate this trauma-informed warm handoff that's really important in these situations. So I think I'll hand it over to Rick, who will talk more about that.
Yeah, so to be honest with you, this information here is just the same information as the previous goal, because these are just considerations that I think are super important and vital to this as well. But the one thing that I think is really, for me, really mindful is, does the survivor know that you care? And if so, how do you show it, right? And so I think Dixie did an amazing job of explaining how you can do those things. And so bottom line for me in putting this into practice is show that you care and let them know so they see that you care. And that involves how you interact with them, acknowledging their trauma, and ensuring that that I like that warm that warm handoff is something that happens on all levels.
Yeah, something I would add and want to reiterate from part one is the relationship, the rapport, the trust between the advocate and the survivor is the most, one of the most important things in recovery and healing and things like that. When we talk to survivors, that's the thing that comes up over and over. And we've talked to survivors about this in a lot of different contexts. Really, the relationship they have with their advocates sets the tone for their entire experience with services on and off campus. So our question then, discussion to put in the chat is, how do you build trust and rapport with the individuals that you work with? What practices do you use? Yeah, so Joey put in the chat, this is about the last question, but it's really interesting. He says, hoping that you're doing outreach events, hoping to spread the message of advocacy and prevention and lessen the discomfort some individuals have with working with male advocates. So I think that's super important. And I just had an interview a couple of months ago with a survivor that was talking about that, about how they were really unsure about having a male counselor at first. But because of that rapport and trust that the counselor built over time, that survivor ended up unfortunately having another experience of violence, but knew who to reach out to immediately. And they were able to go back to that counselor who does counseling and advocacy work. It's kind of a split position, but the survivor knew, okay, this is the person that will go to when things happen.
Okay, should we? Okay. I love the things I'm seeing over here in the chat about putting tote bags together and eye contact and providing attention and active listening, meeting people where they're at. All awesome. I want to make sure that we have time to talk about the last two goals, and I want to make sure that we have time for any questions from the group. So I'm going to talk about academic support, which is another way that kind of campus-based advocacy is a little bit different from community-based advocacy. And certainly we have survivors engaged in school, from high school, middle school, all the way through, college in all of our community work. But we have a particular focus on academic support in the college campus arena. And part of that is through things like partnering with the Title IX office, Disability Service Office, and financial aid. So those were those kind of adjacent systems we talked about in session one, partnering to provide academic accommodations. Academic accommodations are one of the most powerful tools advocates can not only advocate for on the macro level, but can help survivors get. Because of the impacts of trauma, because of some loss of material resources, it's really critical for survivors to be able to get help with their academics in order to stay in school or finish a semester, or, and sometimes that may look like, what's the bare minimum you can do to pass your classes this semester? So part of meeting survivors where they're at is figuring out what their goal is for that academic experience. And part of that academic support, along with those academic accommodations, is safety planning. So if you're in a small major, my major of social work at Indiana University had 24 people that all had every class together for 2 years. So if you had a problem with one of those 24 people or a safety concern, you would have to make some pretty intensive accommodations in order to get safer. So advocates work on all of those kinds of things so that survivors can meet their academic goals. And what happens when advocates are able to do that is that survivors have an increased sense of institutional trust. So academic support and collaboration amongst systems on college campuses is the antidote to institutional betrayal. It's the way that we foster institutional courage and trust. If we go to the next slide. The skill highlight for this is what we call academic safety planning. And I'm not going to do too much on academic safety planning because I just want to hype our academic safety planning webinar that this team has happening on August 17th through TCFV and TAASA as a partnership of this whole group that's been working together. So check out TAASA's social media and TCFV's social media to sign up for that free webinar on the 7th. Is it the 17th, Dixie? Do I have that right? Okay.
Yes.
Yeah, it's going to be awesome. But academic safety planning is basically how we work with survivors to help academic accommodations happen, work on safety planning on campus, work on trauma-informed physical spaces, and guide survivors through complex institutional policy and procedures. So it's really a version, it's the campus version of safety planning. And it's so important that we have a whole other webinar about it. So we will be presenting on that. Our colleagues that are not here today, but are part of the toolkit team will be presenting on that on the 17th, and expect to see email invitations and such for that. And you can always reach out to one of us to get more information about that. So we can go to the next slide.
So there's not really much more to add. Leila so eloquently laid everything out specifically about what academic safety planning looks like. But I think, again, if you're looking at it from a trauma-informed lens, there are considerations that we need to take into effect, right? So are there things that students or others can do that would make someone feel safer at school? Yes, absolutely. And these are just a very basic outline of some things that are really helpful, but also impactful in a positive way. Things like changing a class schedule, right? Providing bus service or taxi service or rideshare service to and from school. Taking a leave, allowing a student to take a leave of absence, right? Changing a residence hall, moving a locker, providing an escort to and from classes if that's something that's needed. Change practice or meeting times to accommodate. Create safe dining hall hours, and designate a safe parking space. I mean, this is, again, not an exhaustive list, but just some of the things that we can highlight. But anything that you can think of that is going to ensure academic success, ensure and lessen the impact of what happened to them so that they can succeed and be all the things is really, really, really going to be impactful for that survivor.
I wonder if, just so we have time to get through the goals, if we should kind of maybe skip this discussion one and get to the next one. Does everybody feel okay with that? I'm sorry, I'm a Capricorn, major time.
Yeah, so their final goal, goal 7, is really talking about macro advocacy. So how we as advocates and individuals working with survivors can enhance collaboration and survivor experience across campus and the community. And we've talked a lot about this broadly throughout both part 1 and part 2 today, but the job of an advocate is so broad and includes the micro, individual, one-on-one type activities that we've been talking about, but it also includes this macro view of the system, how the system needs to be improved for survivors, how we can collaborate with other individuals on campus and in the community where the holes are, where we need other resources, and how we can, so a lot of things in the chat talking about these education opportunities and outreach opportunities, and that's awesome. That's totally part of how to advocate on a macro level to strengthen institutional trust, institutional courage, and overall create a trauma-informed campus. So the skill highlight is really thinking about how to educate the campus community on these three big things. So as an advocate, how can you help people understand the community systems, both how they impact survivors and how they impact services that are accessible, what campus systems are available, and the campus community environment that we've been talking about a lot. So I'll move on because we really have addressed this, and it seems like there are a lot of people on this workshop doing really great work in this area already. So I'll pass it over to Rick to talk about the cost of caring.
So again, we know that staff that work with trauma-affected persons are going to be impacted. We know that educational systems and institutions and all of the things that work together to ensure that a campus runs smoothly are going to become traumatized as well, right? That's part of working in this movement, and it's part of understanding someone else's victimization. So vicarious trauma, secondary traumatic stress, secondary victimization, all of those things are valid and they're real. And so that's at a cost, and it's at a cost most of the time to the people who are responding and the folks who are working to ensure that all of these policies and procedures are in effect and are effective and are doing what they're supposed to do. But I think the other cost of caring is I'm going to reiterate this again, is the fact that it makes a great case for why this kind of work should be institutionalized. I've said that 80 million times and I'll say it again. And let me tell you why. Because when you invest specifically in this type of advocacy or this type of trauma-informed approaches to how you deal with students and the trauma that they bring with them every day, to how you respond when a survivor gets sexually assaulted, it matters. And what we find is that a lot of campuses are either relying on Title IX offices to kind of help navigate some of that stuff, or relying on other students, or relying on, counseling departments or women's centers to kind of take on a lot of the focus of this. But if we worked to, again, institutionalize and make a case to Board of Regents and university presidents and the powers that be, the importance of why this is a necessary thing to incorporate into every aspect of a student's life and how we treat and navigate a student's journey through our educational system, it makes sense to do that. Other campuses are also relying on grants, grants where funding is becoming minimal. And, there used to be pots of money that were very specific to campus advocacy that campuses could apply for, and it was designated specifically for them. That is likely, it already has gone away and likely won't return. So now you've got campuses who are competing for the same pot of money as rape crisis centers. And so, it's going to have an impact. So again, the cost of caring is great in terms of the impact that it has on staff that work with trauma-affected people. But the cost of caring is also an investment, and it's an investment in students' well-being and student success on specific campuses. And again, it pleads the case that these kinds of services need to be institutionalized in some way, shape, or form. Okay, so really quickly, this goes back to that goal. Just some things to consider for students. Do survivors have a significant role in planning and evaluating services or activities? How is this built into department activities? Does staff communicate respect for a survivor's life experiences and their history? Are survivors involved at, service program or event planning meetings, or are their priorities sought and validated in formulating that plan? And does the program department or organization cultivate a model of doing with rather than to or for? Bottom line is, are survivors at the table? When you're planning events that are geared towards awareness, or when you're looking at services that are geared towards survivors, are they at the table being allowed to give input, being allowed to provide feedback, being allowed to kind of drive a lot of the conversations about what services should look like. And the answer to that should be yes. And if not, let's find a way to do that.
Do we want to see if since we have 2 minutes left, do we want to see if we have any questions from the audience that anybody wants to chat in? Anything that's kind of, all these slides, so there was a few slides that we skipped or didn't have time for, are all going to be available. And some of those great slides from Rick about trauma-informed practices and different settings and skills from slide 1 and 2. Like, I encourage you all to use those as kind of institutional assessments in some ways, or checklists, things to consider when you're having staff meeting, just your own inventory of how these practices are being implemented. But are there any burning questions for the group? I think I speak for all of us when I say that we are really passionate about this and would be happy to answer emails or chat further. The whole focus of the toolkit is evaluation tools. I'm really passionate about evaluation, which I think is a boring thing about me, but it is a true thing. So if anybody wants to talk about how to evaluate their campus efforts, we're here for that. But please feel free to reach out to us for any support we can provide.
So there was a question about where we can access the slides. They will be available, Crystal, are you on? They'll be available on our website beginning a week from now until like September, am I correct?
Yes, they will be available on the conference website after the conference is concluded, beginning on Monday. Some presenters did allow for things to be shared early. You can keep checking it, but most things won't be up until Monday. And of course, that is if the presenter has given consent. So we know we have consent for this presentation, but if you do attend a different workshop, they might not have given us consent for that one. So just keep checking that conference website. And of course, some conference slides won't be available.
And I want to say really briefly, it's always an honor and a pleasure to work with folks in the academic setting, specifically Dixie and Leila. We've worked together for many years, and I'm always astounded and amazed at their passion, their level of involvement, and the care that they put into really understanding a student's experiences and how to make them better. Because that is something that rubs off on me. And I like for them to take the lead because I learned so much from them. And so thank you for being a part of this. I appreciate you allowing me into the space as well, and for letting me be a part of this team, and for letting TAASA be a part of it. And to all of the campuses that we mentioned specifically, UTEP, UTRGV, University of Texas El Paso, UT Rio Grande Valley, UTSA, Our Lady of the Lake, Trinity University, those are just a few. And I don't give preference to anyone, but they are doing amazing work, but they're just the ones that keep in contact with us and really kind of help drive a lot of these conversations. So I encourage you to reach out to them, do some digging on their website, look at what they're doing, look at their offices and their victim support. And if you have any questions, they are amazing resources. Please reach out to them. They can not only help you build, but they can also help you sell the importance of this type of advocacy on a campus. So.
Thanks, everyone. Right. And feel free to reach out to me or Leila if you have any questions, or specifically for me, if you need any of the publications that we put in the chat, feel free to let me know and I'll send you PDFs.
All right. Thank you, everyone. Please join us for the closing keynote after this session that starts at 3:30. Don't forget to try and do all your evaluations on the same device. We've posted that link in the chat box, and when the session closes out, there's also a pop-up of that. So please continue to do those on the same device so you don't have to start over, and we will see you in the next session.
Thank you, everyone. Have a great day.